My name is Yunus Msayib. I'll be speaking about the PET MR analytics that I have been developing with my colleague Dr. Chris Buckley. This work is about getting more out of the information available in a PET MRI scan using automated analytics. The focus of our analytics is dementia, and the aim of our work is to produce individualized patient biomarker reports of dementia pathology. And the idea is with these individualized biomarker reports is that they can help the clinician form an understanding of what the underlying brain diseases might be in a subject who is presenting with cognitive decline. One of the big challenges with dementia is because it's a progressive disease, it's difficult to have diagnostic certainty in the early stages of the disease. That's a stage at which an intervention is likely to carry the greatest impact. Typically, a subject would present at a clinic with a level of cognitive impairment that's abnormal for their age, but not so low that it impairs their ability to function on a daily basis. This is known as mild cognitive impairment. Somebody with a mild cognitive impairment won't necessarily go on to develop dementia, but they do represent an at-risk group in whom diagnostic uncertainty is high and would benefit the most from an early intervention. And the key question to be asked for somebody with mild cognitive impairment is, what pathology is present? Because the symptoms would likely be due to a specific pathology. Knowing the pathology helps one to understand what the likely trajectory is of a patient's symptoms and what the best care pathway is for that patient. So somebody with Alzheimer's disease, for example, will have a different treatment plan to somebody with vascular dementia. And it's this question, what pathology is present, that our individualized biomarker report seeks to help in answering, therefore helping to facilitate an early diagnosis for the individual patient. Where PET MR image analytics comes in is that imaging biomarkers have shown a strong association with dementia pathology. When somebody is suspected of having dementia, in the first instance, we want to be able to rule in or not Alzheimer's pathology. This can be done using a PET scan, where the PET tracer binds to amyloid plaques in the brain, which are a pathological hallmark of Alzheimer's disease. If a subject's PET scan is amyloid positive, as shown on the right-hand side, this confirms Alzheimer's pathology, and we can turn to the MRI scan to get an understanding of atrophy to the hippocampus, where the extent of injury here is predictive of dementia rate. In subjects whose PET scan is not amyloid positive, we can use different MRI biomarkers to get an understanding of what the underlying pathology might be. What we have done is develop an app that automatically extracts biomarkers and compares them against cognitively normal aged matched values, and then synthesizes that information in the form of a concise clinical style report. This is a case study of a subject who presented with mild cognitive impairment. If we start off by looking at their visible PET scan, what we see is that they have a distribution of red-orange hues in the frontal lobe and in the temporal lobe, on the basis of which this patient would be classified as being amyloid positive. If we home in on the striatal structure in the brain, uptake of the PET tracer here is associated with a higher conversion likelihood to Alzheimer's disease. If we turn to the subject's MRI and make an assessment of their neurodegeneration biomarkers, we find that the hippocampal structure, which is associated with memory formation, is mostly intact. It doesn't show a significant degree of atrophy. And the same could be said for the subject's cortical structures and their ventricles, which, whilst exhibiting a degree of enlargement, it's not to an abnormal extent for somebody of this age. So taken together, this visual assessment of the subject's biomarkers suggests that they are at an elevated risk of developing Alzheimer's disease, but that the neurodegeneration phase hasn't yet started or is in its early stages, and therefore this would be a good case for early intervention. And during the 3-year time frame of the study, this subject did not convert to Alzheimer's disease. This information gets represented in a quantitative and automated way on the patient's Dementia Biomarkers Report, along with some additional insights. What we can see is that the patient's PET biomarkers are positive, and the neurodegeneration biomarkers are mostly negative or borderline. If you're interested in using a demo version of our app, which also supports FDG, PET and other PET tracers, please get in touch with us at the email addresses shown.